Hello guys, welcome back to ASAN network. I am your Dr.Salauddin, MBBS MS Orthopaedics, and this is a fracture classification series. So the next fracture in the classification series we are going to discuss is the most important one in the femur's part, the lowermost, that is the distal femur classification, distal femur fracture classification. Distal femur fracture classification. Before going into the classification part, we'll be dealing little bit about the anatomy of the distal femur because it is very peculiar. So what is peculiar about the anatomy of the distal femur is that, so this is the AP and this is the lateral. Okay. So if you draw a straight line, the lowermost point, that is touching the first, immediately touching the tibial plateau, the lowermost point is the medial condyle. This is the medial condyle and this is the lateral condyle. Okay, it makes about a 15 to 30 degrees angle with the horizontal. So medial condyle is the lowermost part, and in the lateral view, in the anteroposterior direction, this is the anterior most and this is the posterior most. In the anteroposterior direction, the largest condyle is the L for L, that is the largest is the lateral condyle. Okay. So remember these 2 points, the largest condyle is the lateral condyle and the lowermost is the medial condyle, and in between the two is the intercondylar notch. Anterior to this is the patella. Here will be the patella. Okay. Why I am telling you these points is that to know only one word, you must be remembering the screw home mechanism. The screw home mechanism. Okay. So because of this one large condyle and one short condyle, there are 2 arcs of motion. 2 arcs of motion. The lateral condyle having the larger arc and the medial condyle having the smaller arc. Okay. So the lateral condyle which has the more large arc will be having more rotation. So this lateral condyle will cause twisting of the femur. Twisting of the femur. Okay. So in specific terms, if you say in full flexion, the femur will go into internal rotation. In full extension, the femur will go into external rotation. Why this is happening? Because of the 2 arcs of motion, because of one large and one small condyle. This much if you remember, we will discuss these topics more detail in the total knee replacement topic. Okay. Now coming to the classifications. So what are the classifications that are in the distal femur? The oldest classification dates back to 1960s, which was given by Neers. So Neers was the first person to give the distal femur classification. Then the other person to give this classification is Shinjimer. Then the most important clinical classification that you are using till now and in the day-to-day practice is the AO or the Muller classification. These three are the classifications for distal femur fracture. Okay. Now we'll see what is the NEERS classification. So this is the NEERS classification. NEERS classification, there are only 3 types. Simply the undisplaced type, the displaced type, and displaced supracondylar fracture with shaft extension. Okay. So the fracture is undisplaced. Then the displaced with a medial condyle fracture is 2A. If the lateral condyle is fractured, is 2B. And if it is a supracondylar fracture with a shaft extension, it is 3. And 4 and 5, it has comminuted supracondylar fracture, and type 5 is an intra-articular fracture with both the condyles. You can understand better in the image. This is NEERS classification. See, the fracture is undisplaced. So undisplaced fracture or minimally displaced is type 1. If the fracture of the medial condyle with the displacement, here is the displacement, medial condyle and displaced, it is 2A. If the fracture is, this is the fracture here, this is the medial condyle. So the medial condyle fracture with the displacement, it is 2A. The lateral condyle is fractured and with the displacement, it is 2B. If it is shaft extension, supracondylar shaft extension fracture along with supracondylar fracture, it is type 3. Okay, this is a type 3 of NEERS. The type 4 is intra-articular, the type 4 is comminuted, and type 5 is intra-articular with both the condyles. It is NEERS classification. Next one is the Schindler's classification. The Schindler's classification, it is type 1 is undisplaced, type 2 is extra-articular metaphyseal fracture, type 3 is intra-articular with one condyle separated, type 4 is intra-articular with both the condyles involved, and type 5 is comminuted intra-articular fracture. So any fracture, first it is undisplaced, less than 2 mm it is undisplaced. Then type 2 in an extra-articular fracture in the metaphyseal region. Okay. If it is only 2 parts, it is 2A. If it is comminuted, 2B. Still here it is extra-articular. Then from 3 it is intra-articular fracture with only one condyle separated. Then type 4 intra-articular with both the condyles involved. Then type 5 is comminuted intra-articular fracture. Type 5 is comminuted intra-articular fracture. This is the Schindler classification. These are only for descriptive types. These are not much used in the clinical relevance. Now we will go to the most important clinical classification, that is AO classification, or which was given by Muller. 3 as you can remember, alphanumerical classification AO. 3 is for femur and another 3 is for the distal part of the femur. Okay, so in 3 there are 3 types: type A, B and C. 3A, 3B and 3C. 3A, first is the extra-articular fractures. Next it is partial articular fractures. C is for complete articular fractures. Okay, simply extra, partial articular and complete articular fractures. So A1 extra-articular means it's the metaphyseal fractures. Extra-articular means metaphyseal. In metaphyseal, again if it is simple or a wedge or a comminuted metaphyseal. A1 is simple, A2 is wedge, A3 is comminuted metaphyseal fracture. Next, partial articular. In the partial articular fractures, in the sagittal section, if it is only the lateral condyle involving, it is B1. So partial articular, first only the lateral condyle is involved, B1. if the medial condyle is involved, B2. And if the fracture is in the coronal plane, if it is called as Hoffa fracture, it is B3. B3 is Hoffa fracture. We'll discuss little more about the Hoffa fracture in the coming video. Stay tuned. So type C is complete articular. Complete articular means both the metaphyseal and the intra-articular area is involved. So simple articular, simple metaphyseal is C1. Simple articular, comminuted metaphyseal is C2. Both are comminuted, it is C3. So you can easily understand in the images. See, 3A, B and C. A is, it is completely extra-articular, involving only the metaphysis. Then B is partial articular. It does not involve complete articular area, only the partial articular with only one condyle involvement. Only one condyle involvement, it is B. Then type C is both articular and metaphyseal. It is C. So that is called as complete articular. Extra, partial and complete articular, A, B and C. So in A, coming to A1. So in A1 we have divided the A1 as simple extra-articular, right? In A1 again there are two types, that is A1.1 and 1.2. In the A1.1, lateral epicondyle avulsion, these are the avulsion fractures. A1.1 are the avulsion fractures. If it is lateral condyle, it is A1.1. If it is the medial condyle, it is the A1.2. So A1 is avulsion fractures. Then A2 is an simple A2 with a spiral fracture. If it is a spiral fracture or a oblique fracture or a transverse fracture. So in A2, A2.1 is spiral, oblique and a transverse fracture. A2.1 is spiral, A2.2 is oblique and A2.3 is transverse. Then coming to A3, where we have a wedge. Intact wedge is 3.1, fragmentary wedge is 3.2 and a multi-fragmentary wedge is 3.3. Okay, if it is lateral, then we add the qualifier F. If it is medial, we add the qualifier H in the classification. Coming to 3.3b, where the partial articular T3B1, it is involving the mainly lateral condyle sagittal fractures. So through the intercondylar notch, if the fracture is going through the intercondylar notch, it is B1.1, the lateral condyle involving through the intercondylar notch. Through the load bearing surface, it is B1.2. If it is fragmentary, it is B1.3. The lateral condyle in the sagittal pattern, if it involves and fractures in a fragmentary manner, then it is B1.3. So next one is coming to 3.3b2. So 3.3b2 involves mainly the medial condyle in the sagittal format. So B2.1 is through the notch. If it is through the load bearing area, B2.2. If it is fragmentary, it is B2.3. Okay. If it fractures in the coronal plane, so in the lateral view, if it fractures in this manner, this is the coronal plane, and in the anterior flake or the anterior and lateral flake fractures, it is B3.1. Then the posterior unicondylar fracture, any one of the fractures, okay, medial or lateral condyle getting fractured is B. Medial or lateral condyle getting fractured, it is B 3.2. If it is lateral condyle, add F. If it is medial condyle, add H. Okay. Then in the posterior bicondylar fracture, if both the fractures, bilateral HOFA fracture, both the condyles involved, it is B 3.3. Okay. This is the classification for HOFA fracture, B3. Coming to C, the complete articular fractures, C 1.1 is above the transcondylar axis. This is the transcondylar axis. If the fracture is above the transcondylar axis, then it is C 1.1. If it is through or below the transcondylar axis, then it is C 1.3. There is no C 1.2. Then coming to the C2. So in C 2.1, the wedge is intact. Okay. In C 2.2, there is the wedge is fragmented, and multifragmentary metaphyseal is C 2.3. Here the articular area is simple, but the metaphyseal area is fragmented. In that fragment also, if it is intact wedge 2.1, if it is fragmentary wedge 2.2, multifragmentary wedge 2.3. Here both the articular and the metaphyseal area are fragmented. The simple metaphyseal fracture, it is C 3.1. Wedge metaphyseal along with the multifragmentary articular, it is C 3.2, and multifragmentary metaphyseal, it is C 3.3. So this is the AO classification. You need not remember all the 2.1, 3.1, but if you remember what is A1, A2, A3, B1, B2, B3, C1, C2, C3, it's more than enough. Okay, and you have to remember the HOFA fracture. So what did I tell you? What is HOFA fracture? So in the lateral view, this is the posterior part of the condyles. This is called as the posterior condyles, posterior part of the condyles. Okay. So if the fracture is occurring in the coronal plane, involving either lateral or medial condyles or both, it is called as HOFA fracture. This is a definition of HOFA fracture. So what are the classifications used for HOFA fracture is, one is already we have seen the AO classification. Next, the other classification we are going to see is the most useful and clinical classification that we are going to see is the Letourneau classification. And the third one is the recent one, that is CT based Bagaria et al. Or Chandrasekaran classification. So, and one more classification, a simple one, Zhou et al. Classification is also there. But the most useful and the most clinically used classification is the Letourneau classification. Then for the HOFA, the second most useful is the AO classification. Now recently for prognosis and treatment management, Bagaria et al. Is more commonly being used. So we will see what's the Letourneau classification. The Letourneau classification for the HOFA fracture. There are three types in the Letourneau classification. The type 1, type 2 and the type 3. Okay. Again, type 2 has 1, 2 and 3. Type 2 has again 3 subtypes, A, B and C. Okay. So type 1 is a vertical fracture parallel to the posterior cortex, and it involves the entire condyle, and there is a good soft tissue attachment to the condyle. So it has very good prognosis. Type 2 is purely intra-articular fracture. This is also called as osteochondral fracture, where the fracture line is posterior to the posterior cortex and often resulting in a smaller and a less stable fragment. Okay, the fracture of the posteriormost condyle behind the capsular attachment. it is behind the capsular attachment. So there is soft tissue attachment is very minimal. So there is a high risk of avian and non-union. If the soft tissues are not attached good, then the blood supply is less to that fragment and there are high chances of non-union and high risk of avian, and hence the worst prognosis for type 2 fractures. So what are the subtypes in type 2? As you can see in the diagram, this is a vertical fracture type 1 which is parallel to the posterior cortex. So vertical fracture parallel to the posterior cortex, it is type 1. Type 2, it is the behind the capsular attachment. Here will be the capsular attachment and it is behind the capsular attachment. So behind the capsular attachment is the type 2. What are this A, B and C? A, B and C is classified based on the fragment size. Okay. So if the fragment size is 75% large, it is type A. 75 is type A. 50% it is type B. 25% of the fragment, that is the smallest fragment, is type C. Which one do you think in ABC has the more worst prognosis? You can comment in the comment section. So continuing with the type 3. Type 3 is an very oblique fracture. As you can see, it is an oblique fracture and it is a more stable than the type 1 and type 2. And it is fracture anterior to the collateral ligament. It is anterior to the collateral ligament, so had a better blood supply than the type 2 and it has intermediate prognosis. Okay, the very good prognosis for this, intermediate prognosis is for type 3 and the worst prognosis is for the type 2. Type 2 has a very worst prognosis. So the AO classification for HOFA is B3, as we have already seen. 3.1, B3.1 is a anterior and lateral flake fracture. Anterior flake fracture is B3.1. Unicondylar is B3.2. If it is lateral F, if it is medial H, and both bicondylar fracture is 3.3. This is the AO for HOFA. This is the same one given in the matter. Okay. Now coming to Bagaria et al. Or Chandrasekharan classification for HOFA fracture. It is based on the lateral, medial and bicondylar fractures. So the HOFA's fracture as per the proposed classification system is, it has mainly 4 types. Again in the 4, it has A, B and C. So based on the fragment size, so type 1 is a unicondylar fracture with the fragment size more than 2.5 centimeters. Okay, more than 2.5 centimeters. Either it can be medial or lateral condyle. Unicondylar fracture more than 2.5 centimeter, it is type 1. Type 2 is unicondylar with less than 2.5 centimeter fragment size, a smaller fragment, type 2. Type 3 is a comminuted fracture of the condyle. Any condyle that has comminution, it is type 3. Then type 4A is the anterior lip of a fracture. As you can see, anterior lip we have seen already in the B3.1, anterior lateral flake. It is similar to this one. Okay, 4A. Then bicondylar fracture is 4B, B for bi. Okay, 4C is, C is a chondral, so osteochondral. So osteochondral fracture, marginal osteochondral fracture means it's an intra-articular HOFA fracture. Intra-articular HOFA fracture is 4C. 4D is a supracondylar fracture associated with a supracondylar fracture. HOFA plus supracondylar fracture. It is 4D. This is Bagaria et al.'s classification. So they have further divided it into simple fracture pattern and a comminuted fracture pattern. As you can see, so type 1 is the fracture fragment is more than 2.5 centimeter. In type 2, the fracture fragment is less than 2.5 centimeter. Type 3 is, it is a fracture with comminution. So more than one fragment, it is comminuted, is type 3. 4A is anterior lip. 4B is both the condyles. Both the condyles are fractured. 4B is It's 4C. It is 4C. So 4C is a osteochondral fragment. C for C, a very small osteochondral fragment. Osteochondral fragment is 4C. Again 4D is with a condylar fracture and a supracondylar fracture. It is 4D. So from below you can see, if it is more than 2.5, type 1, less than 2.5, it is type 2. If it is comminuted, it is type 3. If the anterior flake is there, 4A, bicondylar fracture is 4B, osteochondral fragment is 4C, and if there is supracondylar extension, it is a 4D. What does this classification help is, it guides in the treatment based on the fragment type. Okay, so if the anterior to posterior for type 1, AP lax screws can be used. Okay, so you can see again in the CT also, a large fragment more than 2.5, type 1, a small fragment less than 2.5, it is type 2. So this is mainly CT based classification, that's why we are used. So it's a comminuted type 3 here. It is also comminuted, it is type 3. The anterior lip, it is 4A. Then both the bicondylar fracture, it is 4B. Here it's a osteochondral fragment, it is 4C with a supracondylar fracture and a bicondylar condylar fracture, it is 4D. Okay, this is a CT place. So for I will show in the CT images only. You can better understand the what type of treatment can be used in each type. Okay. So for a type 1 fracture, an anterior-posterior lax screw can be used. Okay. Anterior-posterior lax screw can be used. For a type 2 fracture, a posterior-anterior lax screw can be used. The head will be here and the threads will be here. Okay. Posterior-anterior PA lax screws for type 2 because to increase the stability. For type 3, either you have to use a plate fixation, a plate along with lax screws. A plate and a lax screw for type 3. Okay. For type 4, again simply AP screws can suffice. Anteroposterior lax screws can suffice. For B, either depending on the combination and the size, you can put anteroposterior or posterior anterior screws. Okay. Then for an osteochondral fragment, you have to use headless screws. Can anyone name the headless screws or pins that are used in orthopedics? You can comment in the comment section. I'll answer in the comment section if you can name the headless screws. The hint is those are titanium screws and the head also has threads in it. Okay, this is the hint for you for name of the headless screw. If you can comment in the comment section, I will give the answer in the comment section. Okay, here you can use the headless screws. The whole screw will be threaded. Then for finally 4D, you can use a rigid locking plate with interfragmentary screws. You can plate like this you can plate, and for condylar you can use a lax screw. Okay, so this is the classification for Hoffa fracture. And finally one more classification, this is also CT based classification, a simple Zoe et al. Classification. A simple coronal split is type A, coronal fracture with an sagittal extension is type B, and comminuted is type C. These are all the classifications used in distal femur fracture. If you want to know more about the other classifications used in the femur shaft and the proximal femur, like the neck of femur classification and the intertrochanteric classification, you can hit the playlist button in my channel, and you can also watch the other videos in my which I have tagged in the description. Thank you.